Whether cancer cervix can be prevented? Yes. How? So there is something like primary prevention. Here we concentrate on health promotion. Means one should avoid the risk factors. Whatever are known risk factors, these factors should be prevented. Also, there should be adequate screening. Right from WHO recommends from 30 to 59 years of age, the woman should undergo regular screening as advised by WHO. And also, friends, there is something like HPV vaccine which is available, and timely use of HPV vaccine can help in prevention of dreaded disease. Also, we can have early diagnosis by screening and diagnostic modalities, timely treatment in the form of treatment of precancerous lesions or cancerous lesions, and follow-up, rehabilitation, and disability limitation and rehabilitation. So all these things are 5 modes of prevention of cancer cervix. Now let us know something about HPV vaccine. Now, HPV vaccine has been developed since many years, but probably people are not aware. Nowadays, awareness is increasing in the minds of people. So let me tell you, there are two types of vaccines widely available. One is quadrivalent and one is nanovalent. Quadrivalent means 4 genotypes of HPV virus are covered. 6 and 11 are low risk and mostly responsible for anogenital warts, and 16 and 18 cause 76% of the cancer cervix. So in quadrivalent, that means 4 genotypes are covered, and the other is nanovalent variety. Nano means 9. So 9 genotypes are covered. Out of that, 6 and 11 are responsible for anogenital warts, and other 7 are responsible for cancer cervix. So if one gets this quadrivalent, means 4 genotypes are covered, then the coverage is probably 76%. And if one affords and goes for 9-valent, that means 9 genotypes are covered, then probably the protection rate may be as high as 98%. But here one should remember that 4-valent vaccine is available in India at 2000 rupees per dose, made by an Indian company, whereas 9-valent vaccine is available something as high as 11,000 rupees per dose. So the cost is almost 5.5% more, and therefore even if one does not afford the 9-valent vaccine and even if one goes for quadrivalent vaccine, it should be fine enough for our country and our population at large. Now let me tell you what is the schedule of HPV vaccination. If a girl at the age of 9 to 14 years, she takes the vaccine, the recommended doses are 2 doses, means 0 and 6 months. So first dose if she takes today, the second dose will be after 6 months. Why is the gap of 6 months? Because it gives more immunogenicity, so more of protection is developed by spacing it for 6 months duration. And if there is immunocompromised person or in this age group, then a third dose is also recommended for that. Now suppose a girl has not taken this vaccine in this age group 9 to 14 years, and if she wants to take between age of 15 and 26 years, she can go for this vaccine that time. But friends, here we recommend 3 doses for this age group. So that means 0, 2 months and 6 months. So suppose the first dose is taken today, the second dose will be taken after 2 months, and the third will be after 6 months from the first dose or after 4 months from the second dose. So I hope this HPV vaccine schedule is now clarified, and more people should go for this. HPV vaccine for girls prevents not only cancer cervix, but it helps in preventing 6 types of cancers of the female population. And the same HPV vaccine can prevent 3 types of cancers in boys also. So HPV vaccination is not only for girls, but it also helps in boys for the prevention of 3 types of cancers and of course the anogenital warts. So primary focus is on the girls, but also the boys can undertake this vaccination so that they will be benefited at large, and this disease can be prevented. Thank you so much. Do watch my other videos on YouTube channel and on Instagram. Get your your children and known people in this age group vaccinated. The earlier, that means 9 to 14 age group, there is more protection and it is better. Only 2 doses are required. Cost saving is also there. But anyway, if person has missed it, 15 to 26 years is also good enough. 3 doses and you have reasonable protection provided for you. Thank you. All the best.